am Karen, and this is Fave Lifestyles. And today we are interviewing Sima from Sima Medical and Cosmetic Clinic in Woodinville. And Sima, it's so wonderful to have you here with us today. Tell us a little bit about your clinic and what you do.
Thank you for having me, Karen. I'm just truly blessed and honored to be here tonight after 10 years of running and operating our medical dermatology clinic in Woodinville. SEMA Medical, we do medical dermatology, cosmetic dermatology, and aesthetics.
Well, that is really awesome. Well, I was had the privilege of talking with you the other day, and I was just so interested in why, how do girls know when to come to you? What are some of their concerns that they would ask you about?
I think girls and guys can come whenever they feel like they need help with their skin, which starts, in their teens with acne, and then it just evolves with, wrinkles, then hormones, hair growth, and just volume loss. So, and also for medical reasons as far as moles and skin cancer and prevention and treatment.
Oh, awesome. I know when we were sitting together, you had a form and you said to point out the areas that I was concerned about. So we talked about a few things. I've been in the sun too much and I'm getting to that age where, yes, I have wrinkles. And it was just fun to hear about some of the different things that you do. Tell us about some of the procedures that you can have, like if you have wrinkles. What are some of the things that you can do?
Well, I always ask our patients what concerns them the most. It's really about them, and also I can offer assistance of how I think I can help their concern and help rejuvenate them. My role is not to make you look like somebody else, just yourself and more rejuvenated, so that people notice but they don't know.
Right. And you were talking about how when you see people and how much better it makes them feel about themselves.
It's all about themselves. They're doing it for themselves, and they feel so much better about how they look because they usually feel good, but their faces and the wrinkles or the way they look tired makes them look tired, and they're really not.
Right, right. And as we age, we lose some of our definition and things kind of shift around in our face.
Usually come down, yeah.
Yeah.
Drag down.
Yeah, so what are the newest procedures? You were talking a little bit about some of the lasers.
So lasers are always changing and new ones are coming out, but our newest is the one that's fractionated radio frequency, helps wrinkles, scars, and does tightening. So we have several different lasers, and they all have their place, but certainly this is our newest, and we're really seeing great difference with skin
Oh, that's
texture.
awesome. And so one of my questions, and I know we all have questions about like, can I have this procedure done or what will it do? Will it change my expressions? And we were talking a little bit about Botox because you hear a lot of different things out there and some not true, some, it's amazing what you can hear. So I was asking you about if it changes your expression and you were telling me about that.
Well, it really shouldn't change your expression. It really should not change you. So it should only make you look more refreshed, less tired, more rejuvenated, and relaxed. That's the whole goal
Right.
of doing treatments. So if it makes you look frozen or not yourself, that's not the way I at least practice.
Right.
So, and I would tell you, that's not, no, we're going out of limit here.
Right. Well, I know you sat with me, and I just loved all the attention and the just real detail how you explained everything. It was really awesome.
Thank you. As
Yeah.
nurse practitioners, we have that role of a lot of patient education. And of course, I have wonderful staff that has helped me through this. Tamala and Claudia have been with me for years, and they help out. They're both very knowledgeable in dermatology. So we're lucky to have a really good team
Yep.
to help with Angelina, our newest addition.
So just tell us real quickly how you kind of you come in and there were 3 points you said. You consult, and then you talk about fixing or reversing with your clients, and then prevention.
Right. So, 3 stages as far as prevention. First
Okay,
step, prevention is so much more important than actual treatment. So, and then treating whatever has already happened. Skin cancer really is a concern here, and we need to make sure that we do screen for that. And unfortunately, highest melanoma rate is in the younger generation, 25 to 29. So we need to keep an eye on that and do full skin exams. And the recent new article with family practitioners doing skin exams not as effective at all as dermatology trained eyes doing it. So, and then of course the aesthetic ones, what we can reverse in our faces and bodies.
Yeah.
are-
And I picked up a sunscreen that I thought was really nice, a tinted sunscreen, and it actually feels really, it's really silky. It doesn't feel like all full of chemicals, and it was really nice.
Yeah, we have our own line. We have medical grade products only in our office. So feel free to try sample tonight and ask us any questions you have about anti-aging and also preventative and rejuvenative.
Awesome. Well, thank you, Sima, so much
Thank
for
you so
joining
much
us.
for
Yes,
having me.
yes, you
Thank you.
bet.
Yeah, look forward.
We'll see you next time on Fave Lifestyle. Thank you.